Heidi Otway, your host for this conversation on cannabis virtual forum, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about cannabis nursing, a profession that is emerging in the medical marijuana industry. So let's talk and learn about this subject from our distinguished panel of medical professionals. First, we have Dr. Joseph Rosado, a nationally and internationally recognized best-selling author and medical cannabis expert based in Florida. Dr. Rosado, it's good to have you back on the forum. Tell our viewers and listeners about yourself.
It's always a pleasure to be back. Good afternoon, good morning to those of you that are on the West Coast. I am Dr. Joseph Rosado, primary care physician by trade, and have been recommending medical cannabis here in the state of Florida since August of 2016, managing both adult and pediatric cases. So my experience is quite vast, as well as not only with ages, but also multiple qualifying conditions.
Thank you for being here today. Our next panelist is Ivory Rosenthal Davis, a registered nurse who owns Rosenthal Consulting Solutions, a healthcare firm based in Louisiana. She and our other panelist, Sandra Gwines, are the founders of Cannabis Nurses of Color. Ivory, welcome to the forum and tell us more about yourself. You're on mute.
Unmute.
Thank you. Welcome. Thank you for welcoming me so much. I appreciate it. So yes, I am Ivory. I am in Louisiana. Well, today I'm in Chicago, but I'm based in Louisiana. And I usually like to follow the politics and the policies, health policy focuses with following the cannabis space. You'll hear more about that in a little bit, but myself and my counterpart, Sandra, we have a joke that I like to touch the policy and she likes to touch the plant. So in Louisiana, under Louisiana Cannabis Nurse Navigator, I tend to help patients navigate through the space in Louisiana, from getting a referral to a provider to going into a dispensary and helping to really hold their hands to get through the space. So I'm excited to be here. Thank you.
All right, we're glad to have you. And rounding out our panel is Sandra Gwines, a registered nurse based in California. In addition to being the co-founder of Cannabis Nurses of Color, she is an active member of the American Cannabis Nurses Association and is also known in the industry as the Kush Nurse. Sandra, welcome to the show. Tell us more about yourself.
Hello, and thank you so much for having me. As you mentioned, I am a registered nurse. I live in San Diego, and really coming from a very conservative East Coast lifestyle. I grew up in New York, and I lived in the South for quite a while. My husband's military, so we traveled and then we moved to California. It really opened my eyes to cannabis as medicine, and I realized that there was a lot of gaps in education and misinformation. So really my goal is to educate folks on how cannabis can help them. I do consultations and coach clients that are interested in using cannabis as medicine. And as you mentioned before, Ivory and I have started the Cannabis Nurses of Color as a way to help other nurses find their footing in this space and really get reliable information and evidence-based information into their hands so that they can serve patients as best as possible and really, spread the information that is necessary for cannabis to be considered medicine, because we know that in traditional settings, it is still not seen as medicine.
Yeah. Well, we're going to talk more about that. To everyone joining us on this live forum, please share, post, and tag a friend on Facebook to have them join us in this conversation. If you're on YouTube, share the link so others can join us as well. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have our guests answer them for you. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comments box on YouTube and Facebook after the live program. Your name will be entered into a drawing on August 11th, 2022 to win a $100 gift card provided by one of Mary's partners. Now let's start this conversation on cannabis, about cannabis nursing. So as you all both mentioned, cannabis nursing is an emerging profession that's getting a lot of attention. So Ivory and Sandra, tell us what prompted you to move into this line of work. And Ivory, I'll start with you. What prompted you to get into this line of work?
Sure. A few years ago, in a previous role, I worked as a workers' comp nurse case manager. So I frequently assisting patients. All of my patients were injured on the job in some form or fashion. And I've had patients, sometimes they will have a simple slip and fall, and it could be something that we thought they'll be up and back to work in a day or two. And it ended up being a catastrophic injury or something that, they became disabled, permanently disabled. And sometimes they were surgical candidates, sometimes they were not. But most of the time, these patients ended up on some form of opioid or another. So just long and short, I had a patient one time that just asked me after just having a trial of opioids that were not effective, the line of work that the patient was doing, he could not be on opioids. And he just, at that time, Louisiana was just building out its system, its program. And the patient asked me, he asked me about medical cannabis, and I had no clue. And I really had to go and research. And I like to say from there, the rest is history, because once I began to really research and find the information, I quickly realized that the information was not easily there. It wasn't easily present. And just helping that patient through the process of getting his question answered so that he can seek another form of treatment, it really led me into now what we call cannabis nursing and just a whole world of helping patients through this process.
Mm-hmm. Sandra.
So I came to cannabis as a patient. I was looking for resources for myself because I was suffering with a lot of depression after I had my daughter and a lot of postpartum back pain issues. I was seeing a chiropractor, acupuncturist, all the things, and I just really felt like generally I wasn't doing well. I had a lot of autoimmune conditions I was working through, and I just really wanted to find some other options. So I wasn't open necessarily to cannabis, but someone introduced CBD to my life, and they were like, try it, and it didn't work. But that's okay, because I think what I learned in that process was CBD can be helpful, but unlike medical cannabis, it can take time for those results to be seen. And I didn't really have time on my side because I was having acute symptoms that needed to be managed, immediately. So saying all that to say, it took me down the path of learning about cannabis. And then I realized that there was so much research out there, yet none of my counterparts knew anything about cannabis. I worked in the medical setting. I hid my cannabis use. I suffered from more mental health issues because I was hiding the use of my medicine. And then I realized that this just wasn't, it just didn't make sense to me. And I sat with doctors in the hospital that would sit right behind me, documenting that these patients that were coming in with all these opioid issues were using cannabis, and they would call them cannabis abusers. And there was something about that, just sitting there watching these things be documented right behind me, listening to the doctors. And I just felt like I was living a lie working in that environment. I also felt like I wasn't able to tell my truth. So that's what led me to helping educate. Really, I started with a podcast. I looked at all the research, looked at books, and I just shared the information that I found. I didn't want to be an expert. I really just wanted to demystify what cannabis was and really share with people what some of the research was showing, especially nurses, because I felt that the gap really lied in my specialty, and that had taken me down this path of finding out that there were nurses out there doing this work.
Yeah, I think it's helpful for us to also have folks know, Dr. Rosado, you've been a pioneer here in Florida when we finally approved medical cannabis use. So can you share how you went from your role as a physician to a medical cannabis recommending physician here in Florida? Can you share what prompted you to make that switch?
Absolutely. I'm one of the few physicians that learned about the endocannabinoid system in medical school. Less than 10% of the medical schools in the United States teach on the endocannabinoid system or medical cannabis in general. I studied in the island where Sandra's from, in the Dominican Republic, and because medicine was my sixth career, and so by then I had a family of 4 that I needed to support, and I couldn't do it in the U.S., so we went abroad. And while in pharmacology class, we were talking about different medications, different drugs of abuse, and of course, the toxicology part. The first medication that they talked about was cannabis. And they briefly talked about the endocannabinoid system and the cannabinoid receptors, and then like within like a switch flipped, and it was like, but it's a gateway drug and it's harmful and it leads you to all this paths down the road, and and all the religious and cultural jargon came just bombarding us. Well, I went home that evening and went to what's called the Pharmacological Bible, known as Goodman and Gilman, which is a very thick pharmacological book, which was our textbook. And I looked up cannabis sativa, and in there it read that it was a psychologically dependent medication, but not a physiologically dependent medication. So it's not like your conventional opioids or cocaine or even alcohol that is legal. That, if a little bit works, eventually you're going to need a little bit more to work and get the same effect. Well, that was back in, the early 2000s. Fast forward to 2010, when medical cannabis became legal in the state of Arizona. One of my best friends reached out to me and said, "Hey, Joe, I need a medical director because I want to get involved in the medical cannabis space. And in Arizona, I have to have a medical doctor to be the medical director." I'm like, "Sign me up, let's roll." so, so I was all set, except his wife brought a point that our children, my twin daughters and his son, and their son rather, were 14 at the time. And her whole mindset was, we're telling and teaching our kids to abstain from drugs, but yet here we are getting into the medical cannabis space. And so I called her up and I'm like, "Look, this isn't Joe and Don selling weed on the corner. This is Dr. Dearth and Dr. Rosado making recommendations."
Yeah.
And she's like, "No, Joe, I don't feel comfortable." So squashed. Fast forward to February of 2014, when John Morgan started advertising for the decriminalization of medical cannabis in the state of Florida and promoting Amendment 2. And on a Sunday, I sent him an email to his, John Morgan, Morgan & Morgan website, and said, "I'm a physician, I'm an advocate, how do I get involved?" And within 24 hours, I was involved. I was speaking with the campaign manager, who spent the first 15 minutes of our conversation talking me out of it, because they had other physicians that had said, "Yeah, get me involved, I'm into it," until their partners found out or the hospital found out, and then threatened them of either kicking them out of the group or relinquishing their privileges at the hospitals. And so they all pulled back, and I said, "Look, don't worry about me. I'm from the Bronx. It doesn't matter. Sign me up. Put me in, coach. Put me in." So the week later, I was on the Bureau of Speakers, and as I've restated, the rest truly was history, because I've moved on. I was involved in the writing of the amendments. I was involved in the language. I was involved in a lot of the behind the scenes things that a lot of my colleagues were not privy to. So it opened my eyes, and it helped me be a better physician, but a better prepared physician, because once the law finally was available, I was able to hit the ground running. And like I said, I was the first in the greater Central Florida area, from Tampa up to the Florida-Georgia line and the Florida-Alabama line, to recommend to a 35-year-old female that had stage 3 brain tumor.
Wow.
And then in November of the same year, I was the first in the state to recommend to a 15-year-old child, a boy, that had a stage 4 head and neck tumor. And then because of those two patients, I was on mainstream media, I was on printed media, I was all over social media. And so parents started realizing, oh, that we have a physician that sees children and recommends cannabis for kids. And so they drive, or have been driving, from wherever they are to the greater Central Florida area. And so I've been at it for going on 6 years now.
Yeah. So we have a very, very experienced panel here. So for those of you who are listening and watching, send in your questions, because we got a good group here that can give some insights. So of course, I think everyone knows we always ask people to register for the show and send in their questions for our panelists. And, the overwhelming question I got from folks was, even Mary said, "What is cannabis nursing? Explain it to me." So Sandra, Ivory, who wants to take a first stab at explaining what cannabis nursing is?
I think I'll start and then I'll let Ivory chime in because I will give my perspective and then let Ivory kind of give hers because it's not really a perspective, but that cannabis nursing is not, it's not black and white. I would say that. I think the important thing to know about cannabis nursing is that there are some guidelines that were created in 2018 to help nurses navigate this space. And those guidelines were put out by the National Council for State Board of Nursing. And they basically require nurses to understand the endocannabinoid system, how to work with patients that are using cannabis, to provide non-judgmental care, to understand the laws in their state when it comes to medical cannabis, to understand how patients can access medical cannabis programs, and many other things, to be an advocate and an educator. So what I like to tell people is the nurses work in so many spaces. So when you look at those guidelines, you can really insert those guidelines in many, many areas. I tend to focus on patients because that's what I like to do. I like to work with patients. So I do coaching and consultation and help patients kind of navigate the nuances of what is cannabis and how does it work for me. You know, the way that my practice works specifically is working with patients to upregulate their endocannabinoid system. Sometimes that doesn't even use cannabis. It can be, hey, let's try some yoga and some breath work today and let's see how that works. And then let's see if we add cannabis to that or some terpene rich foods or different things. So I think it's every nurse can find where they fit in this space. And then there are traditional roles where a nurse can work with a doctor, like Dr. Rosado, perhaps, where she can provide the education for the patient, as nurses have done for years. And Dr. Rosado can help to identify, the diagnosis and what's if this person would qualify for the program, and that initial part, which is super critical and important because that's the access for the patient. So I think it's really important that nurses kind of look at this and get creative. And I know that sounds scary because we're not allowed to be creative most of the time in our career. But I feel like, as Dr. Rosado said, many people were not taking the jump and the leap into cannabis. He was one of the first. This is where we are still. Although there are many cannabis nurses right now, this is the time to decide, what is it that I want to do in this area? Just as there's a nurse that works I'm a maternity nurse, just as there's maternity nurses and there's maybe nurses that work in orthopedics, those nurses have specific skills in that specialty that can lend themselves to dive deeper into cannabis for those patients. So we don't want to make it like a one-stop shop. Come be a cannabis nurse, just teach people about the endocannabinoid system, because I think that's a disservice. I think that nurses, where they are needed to know about the endocannabinoid system and what they're doing, and that every bedside and every area should have a nurse that is familiar with this medicine. So I want to make that clear. But again, there's many areas of cannabis nursing. For me, it's understanding the guidelines and then being able to apply them safely in different environments. And then Ivory, I'm going to kind of leave it to her because she talks about some of the lanes and areas that nurses can really make an impact.
Yeah, so we talk about that a lot. We call it the different lanes in cannabis nursing. And to be honest with you, almost every day we discover a new lane. And so when we send something to each other, we'll say another lane in cannabis nursing, because it's really, we feel, because we always like to think about not the current, because we're in a still prohibited state, but we like to think about, what does a regulated cannabis nursing industry or healthcare industry look like? What does the nurse role look like in not what we see now, but once it's regulated? And in our minds, it's as far as you can go. But like Sandra said, it's really just using your current skills and just translating them wherever you like to go. I wasn't really necessarily into policy. I fell into it, into this space and kind of exploring, and just after I realized in my state, in Louisiana, because we're so limited. So we hear nurses always say too, well, why my state? It's not like Sandra's, it's not like California, or it's not like Colorado. And really it's policy. It's health policy. And without getting much, further into that, we feel that there will be a place for nurses to impact change on the local level as well. Here in Louisiana, actually it'll be effective next week on August the 1st. Nurse practitioners will be allowed to recommend or be a certifier, probably right along with our Dr. Rosado. You know, nurses then will be able to assess and evaluate patients to see if they are a fit for medical cannabis. That's something new, and I think now it's hard to keep up. But I think it's either 20 or 21 states now that will allow nurse practitioners to do that. So that's actually a role as well. And then traditional educating. Part of the NCSBN guidelines that Sandra was talking about is that they call for nurses to be educated, or nursing students. So if you're a nursing student, this should be part of your curriculum, just like we learn about the cardiovascular system or the neurology system. We should be learning about the ECS system as well. So buckle up. There are a million lanes, and we're exploring them every day, and we're glad to see it, form.
Yeah, so I want to go to Dr. Rosado. Dr. Rosado, we're based in Florida, and Mary's mandate is to educate Floridians about cannabis. So tell us, what are the rules and regulations in Florida when it comes to how does someone get qualified to use medical cannabis? And then what are you seeing as the role of this emerging profession of cannabis nurses in Florida?
That's an excellent question, because there is, even though the program has been in existence since June 23rd, 2017, which was when Senate Bill 182 was signed into law, even though we as Floridians voted yes with a resounding 71% in November of 2016, our then governor had to wait for the promulgation of the Senate bill and wait for the legislators to pass and write it up. So it wasn't signed into law until June 23rd of 2017. And the only reason I know that is because June 24th is my birthday, and I said that was Rick Scott's birthday present to me.
Okay.
But
so what are the laws in Florida?
But according to the Senate bill, only a medical doctor or doctor of osteopathy can make a recommendation for medical cannabis in this state. Yeah. Unfortunately, a nurse practitioner cannot make the recommendation for medical cannabis or any other physician. It has to be, and it's spelled out and written that way, either an MD or a DO. And they've created a joint committee made up of members of the Board of Medicine and Board of Osteopathic Medicine to oversee the practice of medical cannabis in the state of Florida. So with a very narrow view of that, the role of the nurse educator, or the cannabis nurse, would be more as the role of a nurse educator. I remember back in the day when I was doing primary care medicine, and all of a sudden the diabetes nurse educators came around. And initially it was like, what's that? A diabetic educator? Who needs that? And then all of a sudden we realized, hey, I'm too busy to sit down and, okay, your A1C is this, your glycemic index is this, your LDL is this, your blood pressure is this, let's tweak this, let's change that. I'm writing prescriptions and seeing people and getting them in, getting them out, because, insurance companies dictate and mandate that I see X amount of people within a certain amount of time. Now, all of a sudden, the role of the nurse diabetic educator comes in and like, hey, here, I'm going to send all these patients to you for you to be able to manage that. When I'm seeing now in my medical cannabis practice, typically between 25 and 30 patients a day, and I'm getting them in one every 15 minutes, and I'm doing my recommendations. And if they're new, I spend 30 minutes with them. And if they're a pediatric patient, I spend up to an hour with them, because they need a lot of support and assistance. But it would be phenomenal for me, having a high volume, busy practice, to be able to have a nurse educator, a cannabis nurse educator, to be able to say, okay, I put in your information, I put in your recommendations. I'm going to now hand you over to Sandra or Ivory and let them sit down with you and explain to you, the different chemo bars, aka strains, and which dispensary carries these specific chemo bars and strains, and these different modes of administrations. Why Dr. Rosado made these recommendations, and why it's best for you to mix and match these modes of administration based on your condition. That would take a hell of a lot of pressure off of me
Hmm.
because I'm like, I'm Bugs Bunny. That Bugs Bunny episode when he was a baseball player and he was, Bugs Bunny was pitching, was catching, was right field, left field. That's me. I'm like all over the place. Fortunately, I wrote a book, and so I'll just say, look, go to Google. I mean, go to Amazon. My book's on Amazon. It's available on Kindle.
Right.
If you need want more information, you know, research my book, watch my videos, go to my YouTube channel, and so I'm able to provide that information. But
Right.
there's 2,300 certified physicians in the state of Florida to recommend medical cannabis.
Right.
There's 22 million people in this state.
Yeah.
So there's plenty of room for help.
Yeah. Yeah. So Sandra, you're in California. Ivory, you're in Louisiana. So tell us about the relationship that you all have with the cannabis recommending physicians in your areas.
I'll go real quick, Sam, and I'll let you go. Just short in Louisiana, like I said, the advanced practice RN or the nurse practitioner is new. So
Yeah.
we have yet to see how that develops. Stay tuned. But for right now, it's medical doctors that are the recommenders for our state, and in Louisiana too. When our patients go to the dispensary, and here we call it pharmacy, because
Yeah.
all of our dispensaries are pharmacy led.
Hmm.
To where when you go in there, you have to do a mini consult with the physician. You get questions answered. So that's a little different model. I hear it's I know another state, I can't think of it right now, that may have that model. And we do hear of some states that very limited, but some states that do have nurses in their dispensary. But that's pretty much right now where we are in Louisiana.
California.
New York has
Yeah.
pharmacists on staff
Okay.
at their dispensaries.
And New York just passed their cannabis law. Is that right, Dr. Rosado?
The recreational, the adult
Right.
use.
The adult use. Okay. Good. Sandra, California. What's the relationship there?
It's interesting because I feel like California, because we've had access for a bit longer, that there's almost a wane in like this the advertising and marketing of cannabis for health necessarily. So I feel that, that's not really like a focus of like what people find when they're looking for health options. People find me usually through an ancillary partner or alternative practice partner, like an acupuncturist or a chiropractor or massage
Mhm.
therapist or someone that I have a relationship that recommends me. However, because we have adult use here, individuals don't need to have a medical card necessarily to access cannabis. So I do encourage folks to get the medical cannabis card here in my state because it provides them with discounts at some of the dispensaries, and cannabis is very expensive. It also, not that it provides protections necessarily for all work environments, but I feel like it's always good to have a medical card because you can say that you went to your provider, they recommended this for you. You're not just willy nilly creating this treatment plan for yourself. As a mom, as a person of color, I like to have my medical card just because I like to stay on the safe side of the law. And while it is legal in California, it's just something that I think about all the time. If my neighbor doesn't like the smell or whatever, I just want to make sure I'm good. However, the California way of getting a recommendation, I don't have many providers like in town that you can just go to and get a recommendation. We use many of the 1-800 services, like 1-800 Canadoc type services. I don't know if that's a real service because I don't want to provide like, any kind of endorsements here, but what I'm saying is basically like a virtual visit with a provider. And I have a few providers that I do affiliate work with where like I send them someone and they maybe send me $20 or something like that. But that's not the point. The point is the visits are short. They do it all virtual and they get their card like instantly in a PDF file in their inbox, or they can opt for a physical card to be mailed to them in addition to that PDF. Most of the time, those providers, they're not the general provider for this patient. They don't know anything about this patient's history, what's going on with them, or anything. And I feel like that's the role that I play is I want a holistic picture of this patient. I want to know all your conditions, all the medications you're taking. if possible, I'd like to talk to your primary care provider. I want to advocate for you so that your provider knows that you're using cannabis as medicine. I write letters to the providers, but usually the primary care provider is not the medical cannabis certifying doctor.
Right.
So there's a really big disconnect here. But saying all that to say, in California, many individuals that come to me do not seek a medical cannabis card. They can go to the dispensary and they can purchase it, just like you go to the liquor store. I mean, I hate to use that comparison because they're not, it's not it's not a good comparison because liquor and cannabis are not the same.
Yeah. This is so interesting. I think for our listeners and viewers, the main thing that I want you all to recognize is that every state is different. So if you're listening from California or you're in Michigan, and especially for those who are here in Florida, make sure you go to a credible source. So if you're in Florida, we always recommend that you go to the Florida Department of Health's Office of Medical Marijuana Use. We'll put the link here in the chat, but that's where you can go and learn about what are the qualifying conditions in Florida. As Dr. Rosado mentioned earlier, we have 2,300 qualified physicians here in the state, in addition to himself, that you all can talk to. And then again, some have cannabis nurses in their facilities and some don't. So again, you can find what's best for you. So let's dive a little bit more into this emerging profession of cannabis nurses. And again, we've gotten some questions. Actually, a person who sent in the question is live on the chat here. So this is from Katrina Rivers, who wanted to know, there are many programs that offer a certificate. So when it comes to becoming a cannabis nurse, where do you go, number one, to get educated? And number two, every state is different. And we know Florida, Dr. Rosado, I think you mentioned Florida doesn't have anything for cannabis nurses here. But where can folks go to get a certificate or some kind of education to become a cannabis nurse?
And Sandra, I'm sure you're going to want to chime in on that piece in a minute, but Katrina is correct. Right now, I will say through the American Cannabis Nursing Association, that
we'll put
organization,
the link up for them in this chat. Yeah.
Okay.
Yeah.
That organization is working on a certification. It's in the process. I'm not really sure where that process is, but until then, you can get most of the time like continuing nursing education certificates. That goes through the process. Some of them are 8 hours, 2 days, however long is the process. There's a lot of online education as well. There's actually a lot of information out there that probably wasn't even there 3 or 4 years ago. But to answer the viewer's question is right now, yes, there's not a certification. There is a certificate. And Sandra, you may want to talk about your program that actually goes into a little bit more depth with the nursing education piece for cannabis ed.
So yeah, like Ivory said, there isn't a certification yet. And so for nurses, and doctors as well, you want our specialty areas, we would take additional training, we'd sit for an exam and we'd become board certified. So that's something that's the standard in nursing, is that you would become, a specialist in your area and then get this certification. Because cannabis is a new specialty in nursing, they're in the process of now filing for us to be able to have that certification. We don't know when that will happen, maybe 2 years, maybe 4 years, we don't know, but we are excited to see that this is even a possibility, for us. In the meantime, what nurses are doing is, as Ivory said, taking CEU courses. There are a few colleges that offer medical cannabis for healthcare professionals or for nursing professionals. I actually teach at Pacific College. Pacific College has a certificate program that's 8 weeks. I'm sorry, that's 3 months. The courses are 8 weeks each for the certificate program. And then we also have a master's program that starts in the fall. So if you're interested in a master's in clinical and medical cannabis therapeutics, that program will be starting in the fall. So many people say, okay, I get a certificate or I get a master's, and then what do I do with it? The truth is, and I can't tell you what the future holds, because again, every state is different, every state is nuanced.
Right.
But what I do feel is that right now, it's a big ocean of information, and people haven't been able to dive as deep to get that information. And what's happened is there's so much misinformation that those individuals who go and seek these degrees and these certificate programs, these individuals are the ones that are rising to the top as far as subject matter experts, roles in cannabis spaces. being able to work with patients. Why? Because we are doing the deeper dive by doing these education, by, connecting with Dr. Rosados and, building these networks. We are creating a network of informed healthcare professionals. So
Mm-hmm.
when people ask me, what's the point if we can't go and work in these environments, I always say, we have to start somewhere. And so, if you have the bandwidth and you're able to start taking these educational courses, it's going to fill your toolbox so that you can go out into the world and use these tools where they're needed. I mean, I go to conferences all the time, and every single time I'm in a conference, I'm surprised at how many new people are coming to cannabis. You see patients, you may say, okay, well, I only see 25 patients a day, which is a lot, Dr. Rosado. But you say, I only see 25 patients a day. Okay, well, 25 patients a day times so many days times a year, you're seeing a lot of patients. And many of these patients are coming and it's their last ditch effort. They have tried everything. They're like, this is all. And we want to get to a place where it's not the last ditch effort. So having nurses that are primed and understand this is going to help a patient that's coming in and they start seeing the signs of this patient going through opioid addictions. They might say, you know what, I see some issues here. Have you tried other alternatives? Has somebody talked to you about these options that are out there? Maybe talk to your provider about this. And so just having that information, I feel at the end of the day, it's our due diligence to do no harm. And right now, I don't see many people working in the vein of doing no harm sometimes because we're so afraid of, working within this box and constrained structure that's been given to us. So I think there's a lot of opportunity out there. And as Ivory says, it's moving so fast. So today, yesterday there were no nurse practitioners recommending in Louisiana. Tomorrow there's nurse practitioners recommending. So are you going to be part of this movement? Like Dr. Rosado, his wife was like, no. And he was like, babe, yes. And then now look at Dr. Rosado, And
Right.
so we've all been there. Every single person here has had that conversation where it's like, are you really going down this path? Okay. And so I feel that once you get past that and you look at the vast information, like once you start studying this, you just realize how important it is to be a part of this industry and how important it is to share about this medicine. And it's not about the millions of dollars that you're going to make, but really it's about the many, many lives that you're going to heal, because I see it every day.
Mm-hmm. So one of the, we have questions that are coming in, and someone asks, do you have to have a nursing degree to be a cannabis nurse? This came from Talisa. That's a good question.
It is a good question. I would say, as it relates to the NCSBN guidelines,
What's the NC? Tell me what that, can you spell that
so
out?
NCSBN, I'm sorry about that. That's the National Council of State Board of Nursing. So for
Okay.
nurses, that's the board. When we go to take our NCLEX, that's the organization or the entity that basically regulates the NCLEX. So all nurses will know about that.
Right.
So that board or that entity came out with guidelines in 2018. So based on their recommendations that are nursing specific, they don't like separate between whether you are a licensed practical nurse or a registered nurse or an ADN nurse. They just say in general, nurses who are in nursing programs should be educated on the system. And I think that's awesome too, because we get that question a lot, even from licensed practical nurses, like, okay, is this a space for me? And there is, so that's a good question.
Good. So I wanted to kind of shift a little bit to going back to what Sandra said, and then also what you said, Ivory, is that, you're going to these conferences and you're seeing a lot of new people, that are just kind of interested. So I'm curious to know, what kinds of questions are you hearing from nurses who want to get into this profession? Florida A&M University has a nursing program, right, that is, known across the country. So if those students are listening here, what kind of questions are you all hearing, and what do you tell them?
You want to go first, Sandra? I don't know if she was trying to come off of mute.
Yeah, you can go ahead. Go ahead.
I would say one of the main questions we get is, how you got this, or what make you get into this. And so it's interesting that you speak about conferences, because we're actually in Chicago, and we will be participating this weekend with the National Black Nurses Conference. It's their 50th anniversary. And so we will be on site pretty much talking about the same things that we're talking about now. We will bring the data, we will bring the resources, we will bring to them what once we bring the data, the different, because for me, I tell people, once I knew about the NCSBN guidelines, I dived in, because at that point I said, listen, if NCSBN has said this is real. I need to be paying attention. Even if I'm not interested in it, I need to be paying attention just as a nurse. Even if I don't choose to be if I'm a cardiac nurse, even if I don't choose to per se specialize in the ECS or cannabis nursing, I still need to know about it, because I'm a nurse and my patient's going to ask me. The example Dr. Rosado gave earlier is, the diabetic nurse educator. Well, somebody has to put in a consult to even say, oh, okay, you're diabetic, you're not under control. Let me put in a consult for the diabetic nurse educator. So as a nurse, even if you're not in this space, you need to know when to do the referral and go the next step.
Sandra.
I love that. I mean, she just says such great
That was
things.
great.
So like,
Yeah.
but no, I think, one of the things that, the questions that we get a lot of times, to be honest with you, and it's because we have this information hasn't been public information. I mean, many times we want to know, how does it work? I mean,
Yeah.
that's really the question. Like, how does it work? How is this working? Is it working? Or like, do people just want to get high? Like, you know, it's just all those questions. And usually they don't understand or know, they have no knowledge of the endocannabinoid system. So once we share with them that we as humans have this endocannabinoid system, and not just us as humans, but there's many other animals that have an endocannabinoid system, that we have this endocannabinoid system that's so powerful, and that we can actually manage and heal this endocannabinoid system that works really hard to keep our body in balance, by not only introducing cannabis as a supplement, but also other activities and things we can do. And so when you start talking to them about, some of those activities and how they make you feel, then they can kind of tie in, like, okay, I can understand how cannabis works now a little bit. But I think that's the biggest thing, is how does it work? Can I do this without losing my license? Like, those are things that people are really concerned about. As a professional that, goes to school and gets a license and goes through all these channels, like, you don't want to get to, a place where you lose your livelihood or your license. And we have seen individuals who have struggled, in different workplaces or situations, because they've dived into this cannabis career, and people, their employer or others may not find it as something that, they want to be associated with. As Dr. Rosado said, they get cut from the, from the team because they're, discussing cannabis. I mean, in my work environment, it was kind of like, hey, can you not talk about that at the lunch table anymore? Maybe go sit somewhere else. But I was so engrossed, and I was so fascinated. I just wanted to keep bringing these studies and talking to my coworkers about it. And I didn't believe that something that I was getting from evidence-based journals and that had all this information could be like such a terrible topic to discuss with other professionals like myself. So, I can understand the trepidation from nurses. I can understand the fears, but that losing the license piece definitely is a big one, that many nurses, are concerned with. I always say follow the guidelines, just like anything else. You always want to stay within your scope and standard of practice. The American Cannabis Nurse Association, on their website, they have a scope and standard for cannabis nurses. We have all these resources on our website as well, but it's very important for you to work within your scope and standard. I always tell people, and then even then, when you're educating people, if just like Ivory said, you need to know when to refer to other people. I always tell people, I don't do cancer. I don't know anything about cancer. I don't know how chemo works. I don't know that. It's not anything that I learned in my nursing career. When people have cancer and they come to me, I refer them to someone who understands cancer meds and understands cancer and the pathophysiology of it and all the things. Because how would I be able to educate this person, even if I use all the research, which I can definitely dissect and give it back to you, in a you know a way that you can digest, but I'm not an expert in that. So I think we also have to be honest with ourselves and say, like, if we get into this space and we're doing this type of work, stay within our scope and standards. And also, as Ivory says, stay in your lane. you know, um, because there are, I'm glad to hear Dr. Rosado works with children, because that's an
Yeah.
area that, I'm always looking for people. So now I know, hey, I can reach out to Dr. Rosado. What a great connection this has been for me, because I work with a lot of mothers, and they may need help with their kids. But I usually will recommend and refer them out to other individuals, especially my autistic children. I have a specific nurse I know off the top of my head. She works with autistic children, and then that's who I would recommend to. So I always say, find an area that you're passionate about. In cannabis, there's many different things. Stay within your scope and standard. Use the guidelines as your guide. And also research your state's position on
Yeah.
cannabis for your state board of nursing.
Yeah. Because every state is different. Ivory, did you want to add to that?
Yeah, I was just going to add, when you're researching your state, because people may be like, well, how do I do that? Most of the states, if you go on your Board of Nursing website, most of the time they will have the board minutes there. The NCSBN guidelines that we keep talking about, those came out in July of 2018. So if you go back through the archives and go back and search, it's going to be a while because it's been a few years now. But I would say, before contacting your board, do your due diligence. Go back into the notes, see if they have spoken about it. That way you will at least know the mindset of your board before you even go into, talking to your board of nursing, what the mindset is. As far as we know so far, I can't think of a state yet that I know of that has per se adapted the guidelines. That doesn't mean they have. I just don't know of one. But I like to tell people to go, do the research and see what your state. That's what I did. And then when I saw that my state was mute on it, I contacted them. And that took me on a whirlwind as well. So don't be surprised if you contact your board of nursing, and guess what? They may not know about these guidelines. That's why we're at this conference, and we'll be talking to the different schools of nursing and sharing the information, because your board may not know, or they may do know and just really haven't acting on it. Because when you're in this space, we keep up with everything that goes on. But if you're not in this space, you're not keeping up. You don't know that earlier this week there was a hearing before the U.S. Senate. You don't know that there's a veterans medical cannabis bill that's coming through, and if you are a physician or even a advanced practice RN with the Veterans Affair, that may be affecting you. You don't know that unless you really just study this stuff like we do every day. So don't be surprised if you call your board and they don't know. So that's why I like to tell people too to get active with your nursing organization on the local levels, because this topic is going to eventually come up, and you want to be at the table, especially as an advocate, because more than likely you may be the only advocate at the table, and you want to be there to dispel misinformation, and you want to be there to have the documents and let the documents lead the conversation.
That's good. I mean, this has been a really rich conversation with lots of good educational nuggets for our listeners and viewers. And we only have a few minutes left. So I wanted to have each of you kind of give some closing points, some closing thoughts on anything that we may not have covered that you believe cannabis patients in your state or around the country or here in Florida may want to hear when it comes to cannabis nursing. And then again, we have a lot of people who are interested in getting into this emerging profession. So if you could just share like 2 nuggets on those topics for them as our closing thoughts. Sandra, I'm going to go to you first.
I've been doing this work now for, I think it's 4 or 5 years. I don't know. I've lost track with COVID, but I've seen some amazing and incredible things that I never thought I would see in my life. And that's really hard to say because I have birthed thousands of babies. And I think that's like the most incredible experience that you can have, is to be there, at the beginning of someone's life and to help someone birth a child. Obviously the woman does the work, but you know what I mean, to be there. But I have witnessed some beautiful transformations, from, mental health to physical health to, just people having a turnaround in their life that you wouldn't imagine, just because they now have awareness that they may not have had before. So saying all that to say, there are so many beautiful benefits to cannabis. There's also challenges when you enter this space. And so I like to be open about that. And we've shared some of those. It is a very challenging space. entering this space, you need to be connected to resources and people that can guide you and help you. Banking is difficult if you're a business. You can get ostracized because you're, in this cannabis space by traditional medical practice, traditional, practices or folks in the traditional healthcare space. So there are those things, but at the end of the day, if you're connected, so connecting with like the American Cannabis Nurses Association, Cannabis Nurses Network, Cannabis Nurses Cannabis Nurses of Color, all
Yeah.
the different organizations that are out there for nurses. There's if you're wanting to, work with patients, finding a mentor. I think that's really important in this space because you're gonna, it's not like anything else where you can just go and say, okay, let's see what do people do with these patients. Let's look at, you know, the whatever the standard are at our job. We would always have these policies that we could look at. How to do everything had a policy,
Right.
and we don't have that for cannabis. It's kind of like the policy comes from real world evidence a lot of times, which is an actual thing that the WHO has decided to validate for us, is saying that real world evidence is real, and that we can use this data to really show what's working. And COVID really helped us kind of see that we needed real world evidence, right? So
Mm-hmm.
believe in the real world evidence. If you are somebody that works with patients, write everything down. I journal every single patient. I write down everything because we are literally writing history right now.
Right.
You don't realize what you're doing every day. One day you're going to turn around and they're going to say, Dr. Rosado, remember? And it's amazing. And I mean, 4 years ago is history at this point. Right? I always tell Ivory, I'm like, oh my gosh, like the history, we're in history now. So, join us in this, in the history of cannabis medicine, because it's been a very, very long journey. It's not just 4 years ago. It's, many, many years, right?
Yeah.
But there are a lot of good things that can come out of this space. But connection, networking, finding affinity groups where you can be supported, those are really important. You cannot do this alone. And
Right.
so that is something that I would definitely share, because as wonderful as cannabis is, the working in this space can be tough.
Okay. Thank you. Ivory.
I kind of already went on and gave a rundown, but what I will
No,
say,
that was really good. Any closing thoughts? That was good.
I will say too, piggybacking on what Sandra was saying, is that this is a unique time to shape healthcare. I always think that once we do get past the funk that we're in now, that this is going to reshape healthcare, and that's exciting. Whether you want to be a cannabis nurse or not, if you are a stakeholder, if you are a consumer, if you are, as a patient, we should want to know how this is going to affect us, how it's going to be regulated, and then just to know that we have an opportunity to help shape it. Again, diabetes keep coming up for whatever reason on this session today, but even as nurses, we know about insulin administration and a second nurse verifier, and that's a national policy. And so you
Right.
have to think that somewhere it started, and then it was a good policy, it was evidence based, and now it has gone from state to state, and it's a national policy. We envision one day that our nursing practice will be the same. So whether you're a cannabis nurse or not, somewhere or another, this is going to touch you. So like Sandra said, lean in, get connected, learn what you can. You'll be surprised once you get in here and get the reading, and you just may find that this is maybe something that you're interested in.
Okay. Dr. Rosado.
Well, I'll end this like I end pretty much all my interviews, and that is that cannabis is medicine. It is not a gateway drug. It is your medicine. And I did back about 3, 4 years ago. There's a young man who now lives in Michigan who has mitochondrial syndrome, uh, congenital disease. He's just in a really really bad shape, and the way we ended that spot was I said cannabis is medicine, and then Gavin came on and said cannabis is my medicine. And to hear a child say, this is my medicine, this is what I need to function, this is what I need to live my life free of the pain and the muscle spasms and the anxiety and the depression and insomnia and then there was a cut, the screenshot shifted to a table full of all the medications that he had been prescribed in his young life versus the medication that he's on now with the cannabis. And so, I've said this many times and I'll continue to say it. I'd rather give one medicine for 10 conditions than 10 medicines for one.
Yeah. All right. Well, Dr. Rosado, Ivory, and Sandra, thank you so much for being our guests on this Conversations on Cannabis virtual forum, brought to you by the Medical Marijuana Research and Education Initiative at Florida A&M University. Thank you to everyone who watched this program. Tell us what you think about this forum by completing the survey that will be posted on the comment boxes on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on August 11th, 2022 to win a $100 gift card provided by one of Mary's partners. We want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn more about medical cannabis in the state of Florida and how to legally obtain a medical marijuana use card. We also encourage you to go to the Florida A&M University's Mary website to learn more about this initiative, its educational programs, and additional information about cannabis use in Florida. Thank you all for watching. Great information, great show.